What is public health? Why is it important to you? What kinds of work exist within public health? And how does it relate to the current COVID-19 global pandemic? Happy National Public Health Week. My name is Owen Manahan, and in this video, we're going to dive in to the world of public health. We are currently in National Public Health Week, which is a time to recognize the contributions of public health in the world and highlight issues important to our nation and state of Rhode Island. National Public Health Week happens each year in the beginning of April. This week is put on by the American Public Health Association, which is a large professional group that seeks to improve the health of the public and achieve health equity by creating the healthiest nation in one generation through policy and science. And this year, National Public Health Week has partnered with a research program called All of Us, which has the goal of helping make medicine serve every single person. More information can be found online. Every state has its own smaller version of the American Public Health Association, and here in Rhode Island, we're called the Rhode Island Public Health Association. I know, it's a very clever name. This year for National Public Health Week, RIPHA is working to inspire the next generation of public health students who will become the public health leaders of tomorrow. And in this video, we hope to show you what public health is and how, no matter where your personal and academic interests lie, there is a place for you within this field. Public health is defined by the World Health Organization as the art of preventing disease, prolonging life, and promoting health through the organized efforts of society. But what does this really mean?
I would define public health as population-wide medicine. So not only are you looking at just the acute care needs of the individual, you're looking at the population, the community, people, the environment, a lot of different aspects that go into play that affect people's health.
Really looking at the root causes of all of the inequalities we see in our world and understanding how those create the differences in health that we have in terms of life expectancy, in terms of just opportunities people have and the barriers that they face to be able to be healthy in the first place. So public health is really everything.
So we think beyond one-on-one communication and one-on-one care to really organizing and considering the health needs of an entire population. So that could be your whole community, your state, or even your whole country or the world.
So in general, there are two sides of healthcare, the clinical and non-clinical sides. Now on the clinical side, it's typically made up of people like doctors, paramedics, nurses, PTs, and the other side, the non-clinical side, is essentially made up of public health. So let's use an example to clarify. A man is driving a car and hits a tree. On the clinical side, a paramedic picks him up and brings him to the hospital. Doctors and nurses treat this man's broken leg. But on the other hand, the non-clinical public health side does not work directly with the injured man. Instead, they ask, why did the man crash the car, and what can be done to prevent crashes like this in the future? Was he wearing a seatbelt? Was he texting? Is the speed limit too high? Was he under the influence? Did he have vision issues, etc.? Then policy is developed to limit this kind of thing from happening in the future. Public health always asks, why does mortality and morbidity occur, and what can be done to prevent it? So there are some unique features of public health that make it unlike any other profession in the entire world. There is a social justice philosophy, which means that every single person, no matter what, deserves health and happiness. There are inherent links with government, as public health often deals with different policies. There's an expanding agenda, meaning more and more things in our world today are becoming considered public health. And public health is grounded in science, data, and research, which is very important. There's also social determinants of health, which means that things like work, education, diet all play into your own personal health and the health of your community. And most importantly, there's a focus on prevention and interdisciplinary nature of this profession.
Prevention really is the cornerstone of public health. Investing in prevention has a large return on investment, especially when we look at the population level.
You're looking not only as to why the individual is in the doctor's office today, but what led them there, right? What is their lifestyle habits? What are their eating habits? What is their environment like? Do they have access to greenery? Do they have access to food? And how does that relate to why they've come to the doctor to deal with XYZ? The aspect of interdisciplinary is a wonderful way to describe public health. You're looking at not only as to what the public health issue is itself, but what are the policies at play, whether they be economic, whether they be related to politics, philosophy even. You can also analyze the anthropology behind it, why people have chosen to make decisions, psychology, sociology. I mean, there are so many ways to connect public health to other fields of study.
So now that we have an idea of public health as a whole, what are some jobs in the field and how do you get there?
You could have a public health degree and work in any field. My background and interest for the most part have always been in mental health. I work in weight control and diabetes research, teaching people how to lead a healthier lifestyle.
I'm a registered lobbyist, which is a really cool experience. Some examples of different bills or budget articles I've testified on to date would include increasing access to various services for pregnant women, increasing access to healthy foods for kids in a school-based setting, newborn screenings, etc. I first started down this area of public health after I took a class called The World of Food. And it really was just such an impactful experience for me because I was raised in a community that experienced food insecurity at a very high level. So it gave me language to use to describe my experience and my community's experience in my hometown, as well as the science behind why this is even an issue for so many people.
My title is the Asthma Program Manager. And at the Rhode Island Department of Health, we're responsible for the asthma surveillance system. So all of the data and statistics that get published around asthma in Rhode Island, identifying the hotspots of where asthma impacts people the most. My path towards public health was as an environmental activist. All of the things that an activist does are things that connect very well with public health, because public health is about all of the conditions where we work, where we live, where we play, where we pray, and how social inequalities affect our health.
I'm a nutritional epidemiologist. I started out my career working as a clinical dietitian, and actually I did a lot of work in ICUs, so feeding people who are critically ill. You see patients one at a time, which is similar to medicine. In public health, you work on projects that last for a period of years, and then you change projects. So it's a very interesting job to me because it's constantly changing, but that makes it fun. And so I really encourage you to think about public health as a possibility, especially if you're the kind of person who, really enjoys something new, not necessarily interested in doing the same thing most every day.
There's such a wide range of careers that you can take with public health, which is awesome. But more so, regardless of what career you're in, the community of people involved in public health are so phenomenal, so driven and caring, and really out to work for the best of everyone to make sure everyone can live the healthiest and that our nation maintains to be really healthy.
And the scope of work in public health goes beyond what's been mentioned. Some jobs are better for those who prefer math and computer programming, like health data science, while other jobs fit better with those who prefer to spend their day networking and developing community outreach programs, like program directing. Other job titles include researcher, nutritionist, lawyer, journalist,
Lawmaker,
policy analyst, epidemiologist,
Hospital administration, there's healthcare consulting,
Department of Health,
Teachers and politicians,
biostatistician, activist, community organizer, community educator, nurse.
Having this broad, interdisciplinary, prevention-focused network of jobs working together under the umbrella of public health is important to progress public health goals and keep our population healthy, happy, and well. It's also important to have strong public health in emergencies like the COVID-19 global pandemic we're facing right now.
We are focused on a major emergency in terms of COVID, and recognizing that it's a public health emergency, that we take drastic action.
It's a great example of public health because we can really see what happens with infectious diseases for which we have no vaccine.
We need to change our behaviors and our collective actions in order to address it, and that the things we do right now are going to have an impact in our short-term future.
It's not just that people get sick, because people get sick with colds and flu every year. The biggest issue is the amount of hospitalization and the amount of ICU and often ventilator care that is required.
Discuss the allocation of resources, the health of the healthcare workers, and why we are struggling to have masks and gloves and PPE equipment and ventilators, and who's distributing these goods and how that impacts not just the individual, but the communities, the hospitals, the livelihood. Also going back into economic policy with the unemployment, that is an aspect of public health. I think that the COVID-19 pandemic just goes to show how important and crucial it is that we have such a strong cohort of individuals entering the workforce.
And while this pandemic is daunting and scary and changing our ways of life, every person can enact public health prevention steps. These are things you likely have already been doing.
Personal responsibility for COVID is so important. It's things we can do in our everyday lives.
Wash your hands and always cover your mouth.
Keep your overall health well, as well as getting good night's sleep, eating well, so that your immune system is stronger and better than ever.
Don't go into public places and touch things that other people might have touched and might have left virus, and that you, without knowing it, aren't leaving virus for other people also.
So if any aspect of public health seems to speak to you, what can you do to learn more, and if you choose, begin to take action?
There are many resources that are available to high school students, but also to other people in the community.
Go onto your daily news source. I do this all the time. Even before COVID, I'd go into the New York Times and I'd just go into the health column and I would just read the latest research, policies, whatever it is that interests you as it relates to health. That's where I found my curiosity grow. But also on a practical element, you can go into Khan Academy, which is a great free resource if you want to learn more about the terms and the key definitions that are foundational to public health, like epidemiology. What does that mean? What is case fatality rate? Like, if these terms are kind of thrown at you in the news articles, you can then go to the background information on Khan Academy.
The World Health Organization website is a fabulous place to check out and really look at the broad spectrum of public health.
Anyone who is in the public health field, have an informational interview with them to ask them about their journey, what they do, and how they got to where they are today.
Even within your circle of friends, you can be a public health advocate by using social media and getting that message out.
Go volunteer with your local nonprofit who's working in an area within the field of public health that you find to be most interesting.
Finally, it's important to remember that we are stronger together. But still, as individuals, we can make changes within our communities, and there's no better way to make these changes than through public health. From the Rhode Island Public Health Association to you, we wish you health and safety in these bizarre and strange and novel times, and we hope you've learned something about public health and the potential that you have to join the public health movement and work towards making all communities healthy and happy. For more information about anything you've heard in this video, visit our website at ripha.org or send us an email. We would absolutely love to hear from you. If you have any questions or input, please comment them below. Thank you for watching.